Moving on to our last panel discussion for the day, the role of telehealth in healthcare transformation. And like we always do, let me start by introducing our eminent moderator, followed by the panelist, Miss Muna Jabir, Project Manager, DARZI Limited, Dr. Khulood Alsayegh, Head of Clinical Standards, Guidelines and Consultant Family Medicine, Dubai Health Authority, Mr. James Mathew, Project Manager, Health Information Technology, Health Assurance Hospital Company, Dr. Mohamed Nabil Taha, Co-founder and CEO, Alrazy Group for Healthcare Services, Mr. Fadel, Mahfouz, Cluster Leader, Philips Health Systems, Middle East, Turkey and Africa, Philips Middle East, and Dr. Saurabh Chandra, Chief Telehealth Officer, University of Mississippi Medicine Medical Center, USA. I now hand this over to Ms. Muna to start the panel discussion on the roles of telehealth in healthcare transformation.
Hello, everyone. First, I would like to welcome everyone. I am Muna Jabir from Qatar, and I'm working currently in the Primary Healthcare Corporation. I'm privileged to be the moderator for the panel today. As everyone has highlighted earlier, and we keep saying that the pandemic just helped us to have a significant evolution in the telehealth, and it happened in a very fast momentum. But after those 2 years, the pandemic might be over soon. But telehealth is here and it's here to stay. So, and we all believe that the telehealth will have a role in healthcare transformation, and we are looking all forward to have sustain the progress that we have achieved, and to have the telehealth with a bigger role in healthcare transformation and for a better achievements. So we have a list of questions today regarding the role of telehealth in healthcare transformation. And I have with me 5 great panelists. I would like to start with them the questions. And let's start first with the outcomes of health, of the telehealth on healthcare. And I would like to start with Dr. Khulood from Dubai Health Authority. She is the head of Clinical Standards, Guidelines, and Consultant Family Medicine. Dr. Khulood, I would like to welcome you, and I would like to start the first question with you. What's the most significant impact of telehealth on patient outcomes?
Thank you so much, Muna. Can you hear me clearly?
Yeah, perfect. Please go ahead.
Thank you so much for the presentation. I'm honored to be here this afternoon, and hopefully after this session, there'll be a lot of insight on telehealth for future perspectives. Just to go and answer the question, when it comes to patient outcome, the things towards telehealth is huge. If we visualize the healthcare system as a pyramid, we would notice that the bottom or bulk of the pyramid is mainly on chronic diseases. We're talking about 85% of the entire health cost is on the chronic diseases. And the top part of the pyramid, which is about 5%, is on the preventive measures of telehealth, of healthcare. And now if we take this pyramid and we turn it upside down, with telehealth being a key factor in the change, notice that the majority of telehealth perspectives take place in the bulk, which is the chronic diseases and the preventive measures when it comes to healthcare measures. At the moment, we are aware of what's going on in the hospitals. However, the bed or the number of bed indicator is no longer relevant when it comes to the future of healthcare. What's more important at the moment is what's going on at the patient's house. We don't know what's going on at home. We know what's going on in the hospital, but not at home. So telehealth would take the role in terms of having more screening to the patients, increasing the empowerment of the patient, increasing or accelerating the growth of telehealth at home, giving that empowerment for the patient, increasing, reducing the healthcare cost, and increasing accessibility and equity when it comes to healthcare measures. So an example of that, for example, would be using a device at home, like measuring the lung function and being monitored throughout by the doctor, and therefore increasing the patient's improvement in his outcome and his empowerment.
Thank you, Dr. Khulood. Thank you so much for the details and the information that you gave. As you're talking about where we have realized the most outcomes of the telehealth on patient outcomes. My next question is for Dr. Chandra, Dr. Sarah Chandra. As Dr. Khulood highlighted earlier, where we saw the outcomes, during the pandemic, we have noticed that the most growth was seen in the ambulatory areas. What about other healthcare delivery settings, Dr. Chandra? What we can know about that more?
Yeah, I think the pandemic has shown us the way that telehealth can be utilized, of course, in ambulatory settings, but also in multiple settings. And as I mentioned in my presentation, you need to understand where the patient, receives care. One of the biggest change that has come here in the United States, and I'm sure in other countries as well, is that before the pandemic, home was not considered a site where you can receive care directly from a provider. It was not considered what we call the originating site for telehealth. And even in clinics, for example, some rural clinics were not considered a site unless there is someone there to facilitate those visits. So during the pandemic, we have seen the loosening of regulations and a lot of direct-to-care programs. And what I mean by direct-to-care programs is this is the care delivery model where the patient can initiate the telemedicine consultation. For example, for non-life-threatening conditions, for upper respiratory infections, they can initiate visits and receive care at home. So the paradigm has changed. You are now receiving care not only at home, but because of loosening of regulations that are inpatients. So in every setting, whether you are at home, whether you're in the hospital or post-acute care, whether you are in nursing homes, there is no setting that can not benefit from telemedicine now.
Thank you, Doctor. Dr. Khulood, I'll come back to you also as we are talking about the pandemic. And as the pandemic has in the last 2 years was just out of sudden, what's the impact of the pandemic when it comes to the telehealth and digitizing of healthcare, in your point of view, please?
Well, before the pandemic, the focus of telehealth was always to improve the efficiency of the existing pathways. And since the pandemic took place, it led us to rethink those pathways and test our applicability and readiness to adopt telehealth or the growth of telehealth. So as healthcare regulators in the UAE, we have implemented telehealth fairly quickly. We had the standards, we had the 50 telehealth guidelines, and we are continuously working on the mechanics of updating those telehealth and the requirements, such as, for example, the accreditations that we've been working on. We are working on approving platforms for different telehealth services because during the pandemic, some of the clinics were not able to perform during the pandemic. And what we did is we had to make those platforms transparent and simplified for different telehealth categories for different clinics in order to develop that and then look into the scalability of it, obviously. The telehealth providers in general in the UAE has increased, had both the curve upwards with the pandemic, and we have adopted almost over 180,000 consultations in the government sector, which is a huge success for the UAE. So at the moment, since the pandemic has taken place, there's an increase, definitely a dramatic increase in the adoption of telehealth in the healthcare sector. We have noticed an acceptance more from the patient's point of view. And most importantly, that telehealth is now addressing gaps in the healthcare, which was not open previously because of a low financial appetite. So we're talking things like, for example, research, medical training, and mental health as well.
Thank you so much, Dr. Khulood. Thanks, Dr. Khulood, and thanks, Dr. Chandra, for highlighting the telehealth and from the patient perspective and the outcomes. And as we all know, that there's something that we agree on, that before the pandemic is not like after the pandemic. And definitely the telehealth will have a role in the transformation of healthcare services. So I would like to ask my next question for Dr. Mohamed Nabil from Al Ahli Medical Company. Dr. Mohamed Nabil, the Health Facilities Medical Director. What's the role of telehealth in healthcare transformation after the pandemic? Do you believe it will rotate 180 degree or 360 degree?
Thank you, Mona. It's a pleasure and honor to participate today with this great event, Qatar Telehealth Technology Summit. I'm glad to share my experience with the great and amazing experts and leaders. I enjoyed all the presentations and the panels since the morning. And what makes me more happy that I think that we all share the same vision for telehealth, although we are from different countries and different cultures. Back to your question, Mona. The last 2 years of the pandemic were very stressful and hard for all healthcare professionals, and we lost some of our colleagues and some of our family members. But I think that if telehealth was a human being among us in the last 2 years, he or she would have been the most happy or the happiest person with achievements he achieved during the pandemic. And the question usually, we are all afraid to lose this momentum and to lose what we gained during this pandemic. But let me discuss with you just small story here from Egypt to emphasize what I'm trying to discuss. The Egyptian Medical Syndicate here in Egypt, we have a book called Code of Ethics. This Code of Ethics was published almost year 1973, 50 years ago. We all, as a healthcare professionals, swear after our graduation from School of Medicine that we follow all the ethics inside this book. Let me just show you point 15 inside this book, which states the following. All doctors are forbidden to diagnose or to prescribe any medicine through or via oral, written, visual, data, or aids without conducting the physical clinical examination. This point is still active till the moment we are talking now. But the good news is, after the pandemic, the same Egyptian Medical Syndicate organized the first telehealth summit a few weeks ago and at the end of last February, not just to change this, the code of ethics, no, but to discuss. They invited all the stakeholders for healthcare and telehealth and different organization at the level of the government to discuss and to set a draft for the telehealth law. So after we have a point inside the code of ethics that criminalize telehealth, we are proceeding forward to have a telehealth law, which is discussed now in the Egyptian parliament. So from my point of view, we don't have to be afraid from our achievements for the telehealth during the pandemic. No, we had solid changes and we had solid achievements, but we should be afraid of or should concern to continue the success story and to continue our achievements in this field. Thank you.
Thank you so much, and thank you for sharing this nice example. Actually, it changed. This is what we are saying. After the pandemic is never before like before. So as we are looking at the success and the challenges, I want to ask Engineer Fadel with me, Engineer Fadel from Philips, Middle East. My question for you, we have a lot, we have success, we have many good outputs. What about the challenges? Will the high cost of the telehealth be a barrier in the transformation and adopting the telehealth in healthcare transformation in the future?
Yeah, thank you. Thank you, moderator. Appreciate it. Let me clarify. I will not be generous and share my notes like I did in my keynote speaker. So I'll keep my notes for for this discussion. Look, there is no doubt that there will be a barrier, and cost usually comes. Unfortunately, although we are in the healthcare, I also work for a company. I'm in the commercial sector, so cost is usually the first question that we need to tackle. Look, all the statistics, all the data that had came out so far, it shows that this will pay for itself. When we look at a return of investment, if we look at it purely from a commercial perspective. Now, nevertheless, it remains as a barrier. But if you ask me my opinion, I think there are much more significant barriers that goes beyond the financial aspect of it. So I think during the course of the day, I'm really excited that we're all from different stakeholders, we're putting our heads together in order to tackle these barriers. So the first thing, if you look at data integration. So with telehealth, you need more connectivity, more data. And I think this is where I think the regulatory barriers will come into place. So how can we make it more accessible? As you know, and as I shared with you guys, the impact of telehealth is more it goes beyond the video conferencing or connecting through audio visuals. It's all about the data and how can you put these data into action so that can give us an early warnings so we can save people's lives. And the more we have data connectivity, the more it's kind of open data source, the smarter our algorithm will get. And that from that perspective, I think this is where we need to join forces between regulators, industry leaders, Ministry of Health. How can we make this better? How can we find a better balance out? Now, also, if you look at the statistics, so for example, let me take the Tele ICU because it's probably one of the most mature telehealth solutions that we as Philips have. So it ticked almost all the boxes. So first, the one thing that we can never measure is the mortality rate reduction. I think this is something goes beyond financial. But when I look at the stay, how it made the stay at the Tele ICU about 20, I think 30% less. That's what the data shows. We're discharging patients faster. So as a healthcare provider, you want to discharge patient as soon as possible. If you guys look, I think my colleagues in the US probably are more familiar to this, which is called value-based healthcare. I think it's coming our way in some countries faster than others. But how does value healthcare works? It incentivizes healthcare provider how early you can discharge the patient. So the less your patient spend time in the hospital with a good treatment, the more incentivized you get. And guess what? You cannot readmit that patient. If you readmit, you're not going to get paid if it's the same problem within a time frame. So that also has shown how telehealth has helped out in the Tele ICU, for example. So if you look at these dimensions, I think it definitely pays for itself. If I look in the digital pathology space, so when you did the telehealth, when you did this connectivity, you're doing 20% more than you used to do in the same time span. So your diagnostic productivity has increased. One last example that I can also share is, for example, if you want to do the accessibility to critical care can be done more efficient. For example, we have ICU beds in the States being monitored from Australia during the evening hours. So you don't, so your staff don't have the burnouts. So all this also will lead to cost saving. So I honestly think, from my perspective, it's too expensive not to invest in telehealth, not the other way around. I think this is the future. The bus is moving, and we definitely need to get into that bus.
Thank you, Mr. Fadel. And actually, I agree with you. especially if we look at the spending of countries on healthcare, we will find like some countries will be spending more than 10,000 per capita, while other countries is spending just hundreds of dollars, and we have the same health outcomes. So when we talk about investing in healthcare, it's about where we invest and how it will just help and serve the outcomes of healthcare. So far from the cost, I would like to ask Ms. Dr. Chandra if there is any other challenges or barriers that you can see that will limit the growth of telehealth and prevent us from moving forward.
So yeah, I mean, I think it's a great question, and there are a lot of barriers, to be honest with you, and I think I can enumerate a few of them. And I'll start with the providers, and I'll talk about different stakeholders. So for many providers, this was their first experience of performing telemedicine during the pandemic. And I'm a critical care physician, but I can still say that doesn't mean that you still have you go to medical school, you go through your training, and we train you in medical school during your residency and fellowship on how to engage patients, how to conduct in-person visits. But there's very little education of how to actually engage patients and perform good telehealth, telemedicine visits. And I think that itself is a barrier that the education system should be looking and is looking into, is how to start incorporating telemedicine in your medical school curriculum during your residency training, during your fellowship training, so that your physician providers are now more comfortable. Many had to do telemedicine because there was no other way, but we have to invest in training providers to become skillful in performing telehealth visits. Then that's because that's the only way for them to become comfortable, because they have a propensity to go back to their comfort level, which is the in-person visit. So to sustain telemedicine, we need to invest in their education. Same with the patients. Many of the patients, even here in the United States, who are living in rural areas, don't have good internet connectivity. And that's one concern, that with telemedicine, are we creating disparity between the have and the have-nots, and the patients who are not having internet connectivity, who are not technically savvy, digitally savvy, are they being left off and are not getting the benefits of telemedicine? So we need to think about internet connectivity, broadband connectivity, and it should be available to all customers for telehealth to be really beneficial for all. And then, of course, there comes the regulatory parts, there comes the reimbursement part. I think reimbursement is a big issue here in the United States. Telemedicine in state laws and federal laws were relaxed during the pandemic. Many of the states have now gone back to pre-pandemic regulations, which basically may be putting constraints for widespread adoption of telemedicine, because for telemedicine to be adopted, there should be payment parity, which means the physician, the provider, the health system should be getting paid at the same level as an in-person visit. So those are just some of the challenges that we are facing here. But the Congress and the state government are working with health systems and providers to see how to find ways in removing these barriers.
Thank you so much, Dr. Chandra. Thank you for the information that you have shared. And yes, we are all looking forward how we can enable the telehealth and make progress for the benefit of the patient and healthcare progress. I would like to ask my next question for Mr. James from Health Assurance Hospitals, Dahman. Hello, Mr. James. My question is for you. What may the role of a regulatory body and challenges in supporting the national or regional healthcare ecosystem in enabling telehealth environment in terms of technology, data, and intelligence.
Hi, Mina.
Hi.
First of all, thank you for the organizers and all the members in this panel for giving me such a wonderful opportunity to share my insights. Coming back to the question, according to me, now the regulatory bodies are so mature to handle the healthcare ecosystem by enabling technology in various areas like surveillance, financials, population health, regulating the payers, providers, and they are attaining everything with the help of technology. I would appreciate the efforts by Ministry of Public Health Qatar, which they are going forward with very ambitious projects like TASMU under the direction of Ministry of Transport and Communication, which they identified healthcare as an important sector, and Qatar Health Information Exchange Hub, which is another ambitious project. And they have all considered space for telehealth, remote patient monitoring, virtual consultation, all these efforts. So for all these jobs or all these tasks or all this technology, data needs to act as a fuel, right? So for any technology in the modern world, data needs to act as a fuel. So especially a governance, especially a data governance is needed to be established by any regulatory bodies. I was listening to the comments by Dr. Khulood, and I would appreciate the high efforts that is being done by ministries in UAE for establishing this governance in terms of governance, as well as to establish the policies and standards. So policies, standards, and data is going to be act as the fuel. They need to work in hand for establishing a telehealth environment. And this is the bigger task which any regulatory body needs to establish in a healthcare environment to enable the telehealth world, a neat, clean, and secure telehealth world. Rather than that, we have protocols for various diseases in terms of direct consultation. So another challenge that I would find is that any regulatory body would concentrate on developing protocols based on diseases. We have been talking about a lot about the wearable diseases. So another important thing that all these regulatory bodies are needed to play around with a lot of structured as well as unstructured data. So unstructured data is a bigger challenge. So how we can make use of modern technologies like machine learning or deep learning or artificial intelligence to deal with this unstructured data. Licensing and regulations of providers and technology, many companies are coming up with modern telehealth solutions, technologies. So regulatory bodies should have a clear definitive path to license and to regulate all these modern technologies, their storage, their process, their cloud-based structures, their architecture. So the regulator should establish a definitive environment to regulate all these solutions. Another challenges that I would point out is that we have been discussing about this a lot: the person identity management, data privacies, consent management, the healthcare best practices, how to incorporate standards like HIPAA, data exchange standards. So all these things would act as challenges, but at the same time, it is opening a big road or big room of opportunities for companies, for providers, for regulatory bodies to come into the world of telehealth. Yeah. Thank you, Mana.
Thank you so much. Thank you so much, Mr. James, and thanks for highlighting the role of the regulatory and the other stakeholders that have a big role also in the telehealth and the adoption and overcoming the challenges. But as we all know, to succeed and to have a vision and the targets, we need someone to lead the telehealth and the transformation. So I'd like to ask Dr. Mohamed Taha, who will lead the telehealth transformation? Whom do you think should lead?
Who will lead the transformation? It is a very tough question, and I think this is a challenge for all of us now. Who will lead the transformation, or who will lead the small, steady steps that we need to act now after the huge big leap assisted by the pandemic and the COVID? This is a challenge. I think that the secret or for any success is the teamwork. So we need teams. Teams could be divided at two levels. I think that strategic level and the governmental level is important for most countries, as we heard in national body regulations, and we shouldn't copy paste from other countries. No, every country should have its own regulations and its own systems. So level one is the strategic, that should be organized by the government. And for example, here in Egypt, I just mentioned that the Egyptian Medical Syndicate and the Egyptian Parliament already moved forward. And I think once the telehealth law is active, the next step would be for the Ministry of Health and the Universal Health Insurance and the GAHAR, the General Authority for Health Care Accreditation and Regulation. And I think this is the easy part. The second level is the operational level. All of us, the entrepreneurs, startups, universities, academics, NGOs, hospitals, clinics, doctors, patients. This is a tough question. Who will lead all the activities? Who will avoid? We all start and do the same mistakes. We do not learn from the mistakes of others. We do not advise each other. So I think we should have the body. This body might be NGO, university, whatever. We are still looking here in Egypt for a body like this to connect all those parties, to sit on a round table, to discuss, to implement, to think, to plan, to implement, to share their experiences. Once we do what I mentioned, I think our goal should be just a better healthcare for everyone, a better medical service for the mankind. Thank you.
Thank you. I agree with you. Each country have a different nature, and we will have a different bodies to lead this. In Qatar, as James highlighted, we have a lot of projects, and it's the leader for this MOPH and the national vision for digitizing the services and everything. And in other countries, we find maybe like the States, Medicaid and Medicare, the programs of healthcare insurance are also taking a bigger role in leading the telehealth. So yes, leaders are different across the countries based on what's there and how the healthcare system is established. So as early we have, as Dr. Chandra and Dr. Khulood highlighted earlier about the patient and their exposure to the telehealth. My next question is for you, Mr. James. In the pandemic, there was no other choices. And Dr. Chandra and Dr. Khulood highlighted how the telehealth helped us to access health care. But now, as the pandemic is over, most people still prefer to visit a doctor and go direct and see the doctor in person. How technology can be used to gain confidence among the public and for telehealth possibility from a provider perspective, Mr. James?
Yeah, Mona, yeah, I would like to follow your same statement that pandemic will leave. So what is going to happen to the enormous investments that is made upon this telehealth, especially when it comes to Qatar, big corporations like Hamad Medical Corporation or Seha in Abu Dhabi? They have already put their enormous investments in this telehealth environment. So pandemic will leave, all of people will again start coming back to hospitals. So what we can do to sustain these solutions? So I was thinking thinking about some points that certainly what came to mind that Dr. Saurabh Chandra was also pointing out. That's I would like to repeat that we have to enable the better transmission technology in terms of connectivity. Yeah, we have like every regulatory bodies or the providers of the solution have to ensure that okay, these solutions are going to be work with a better connectivity in terms of better sound, better video, better quality in terms of accessing and using it. We have all parties need to work to come up with an easy consent mechanisms, easy identification management, easy login solutions, easy ways of accessibility, like accessing the telehealth solutions in a mobile device rather than using a computer. Things like that would help to sustain these solutions. And also accessibility of information by providing the wearable devices. Like wearable devices is opening up a world of seamless AI capabilities, and any technology can use this data to derive results. We can derive mathematical models to present results in a simple and more attractive way, like proposing a diet plan, proposing an insurance plan, proposing an exercise plan, make international knowledge-based data available, make international education materials available to the public. So these may be the things that would people love to get it as an add-ons with using these telehealth solutions. And I would like to mention the good efforts by Primary Healthcare Corporation in Qatar. They started a online delivery of medications. Okay, I don't know whether PHC will continue its good efforts or are they going to stop it with ending the pandemic. I don't know. I don't know what's the plan. Okay, so anyway, that was a good effort, right? So things like these will enhance, will enable with it. These are all the good byproducts of these telehealth solutions. And also, yeah, a simple and robust security and confidentiality of data. Now people started thinking a lot about their data. You know, the value of data is being identified, and everybody identify that data is a valuable thing. So they always focus on the security and confidentiality of data. Yeah, so these are some of the things that would enhance to let the people continue using these telehealth solutions. Thank you, Mona.
Thank you so much, Mr. James. And I can confirm for you, still we are delivering the medicine, and you can fill the prescription through WhatsApp.
Yeah.
So hopefully things will continue and even will improve. My last question, I would ask it to Mr. Engineer Fadel from Philips. Technology will be the most important part in telehealth, because without it, we can't move. It's one of the pillars. Let's say not just the most important, but one of the pillars. If there's a pillars for telehealth, it will be between adoption, technology, patient experience, regulatory bodies, and the guidelines. And during the pandemic, it was like an adopted standard to have telehealth as a way to access healthcare. But after the pandemic is over, now it's not the only way, and you can go back to the clinic. What needs to happen for telehealth to be adopted as a standard part of healthcare after the pandemic?
Yeah, thank you. It's a great question. I think we're all scrambling around, especially the one of us who believe in the technology. So we want to keep that momentum that was created with the COVID-19 pandemic. The one thing is, yes, COVID-19 has gave the big push, the motivation, you call it, for the technology. But the technology cannot sustain and cannot stay if we don't implement change management. There's also, I think one of the positive outcomes of the unfortunate crisis is the physicians and the healthcare providers who were pushing back in the telehealth. Now I think we're all aligned that telehealth is not here to replace a physician, and telehealth technology here is not to make a clinical decisions on their behalf. Also, it's pushing the AI in some perspective. So it's here to support them. It's here to increase their productivity, make them and their workflow more efficient. So I think that was a great milestone, because now we can, I mean, you see on this esteemed panel, there's physicians as well talking the same language. There is a critical doctor, and I'm happy to see that, because I remember back in the days before the pandemic, as soon as you start talking about, let's say, tele ICU, the first pushback was, I have enough staff. How, remote, or let's say AI cannot overtake what I need to do. Now, the pandemic created that momentum. At the same time, we were able to build a solid business case with all the data that we have shown. So moving forward, I think we all need to look at it and join our efforts in order to make this happen. So more partnerships need to be established. And here I look at industry leaders like Philips, ourselves. We need to continue to innovate. We need to show the value of such a technology by early warnings. And I heard James as well about the wearables. I think, to be honest with you, we have not seen the impact of the wearables yet. What we have seen is great, but wait till the next years to come. Then you will see the more impact that will affect more people, and how it help us out to reduce mortality rate, for example, and so on and so on. So we need to look at the regulators. We sit down with the regulators and say, look, how can we make this technology more adopted? And we need some flexibility to make it happen, and to make it more feasible on the financial side. So some regulation need to help the telehealth, and you need to incentivize also. So we need to rewrite some policies to incentivize the telehealth delivery. If you're seeing a doctor, I use a simple example, through virtual visit, or if you're seeing physically, it should be the same. I think, the last 2 points is we need to make it vendor neutral. So all the vendors who works in the healthcare IT space need to work together, make it more connectable and more integratable per se. Because I think this is also when the pandemic came, without getting into the technical sides, we had to bypass a lot of the data integration, but now is the time to make it happen. So I think we as Philips, we take responsibility, we'll innovate in that space. I think the pandemic has brought all stakeholders together on the table. We all see the value of it. So now I think the future is just going to get better and better for telehealth.
Thank you so much, Engineer Fadel. Thank you so much. And yes, we are all here, have a big role in this. Technology makers, healthcare workers, and decision makers. We are looking forward to have telehealth to have a better care, better access for healthcare. Technology is not to replace humans, but it's there to support us. So we hope that we will meet again and we can discuss the achievements of the telehealth after the pandemic, and we have benefit from that, and how we have better access even for healthcare by the support of telehealth. Thank you all. I would like to thank you all, Dr. Khulood, Dr. Mohamed, Mr. James, Dr. Chandra, and Engineer Fadel. I would like to thank you all for your information and everything that you have shared with us today. Thank you.
Thank you. It was a pleasure.
Thank you very much, Ms. Muna, for wonderfully moderating the panel. And thank you, dear panelists, Fadel, Dr. Khulood, James, Dr. Mohamed, Dr. Chandra, for sharing your valuable thoughts. We truly appreciate your presence here today. Thank you.
Thank you.
Thanks.
Humanity, rising to the challenge of a lifetime. But we're not done yet. Better has just begun. Let's make healthcare reach everyone. Let's push this world forward, because together we make life better.
Well, what a wonderful and power-packed day this has turned out to be. I'm sure we all have learned a lot from what we heard today on the insights, trends, solutions, predictions, experiences, and for what lies ahead in the future. With this, dear audience, we have reached the end of an insightful and successful day one of Qatar Telehealth Technology Summit 2022 on the experiences and lessons learned from the pandemic and to discuss opportunities, challenges in telehealth. The entire team of TREX event is thankful to our eminent chief guest, His Excellency Sheikh Dr. Mohamed bin Hamad Al Thani, our eminent guest of honor, Professor Mahmoud Adil, our esteemed speakers, eminent panelists, and all our sponsors that we had today, Philips and Advanced Care. But last but not the least, I'd like to thank all our dear delegates for joining us today in huge numbers and making this day a success. I'd like to remind you that we also have the booths which you would like to visit. So please go ahead and visit the booths and see what Philips and Advanced Care has to offer. For tomorrow's session, we once again have an exceptional lineup of some of the brightest minds from the healthcare industry. So kindly do not miss the last day of the Qatar Telehealth Technology Summit between 10 a.m. to 1:30 p.m. Qatar time. The link remains the same as today. Have a great day, stay safe, and I'd like to take this opportunity to wish all of you a Ramadan Mubarak. Thank you.
Ramadan Mubarak to everybody, and thank you so much to all our esteemed panelists, and have a great day ahead. Thank you.